I'm Grover Shanti. I'm the founding director of the Mental Health Co-op, a residential program for adults in Houston, Texas. I wanted to introduce myself and to tell you a little bit about the history of this agency. We've been in existence for over 50 years at the time of this taping. We developed this program so that there were alternatives for people with long-term mental illness or who were just being diagnosed with mental illness as young adults. We operate three different program components. The first component is for the young adult. It's for people generally between 18 and 28 years of age who are experiencing the early stages of a significant mental illness. We define significant mental illness as an illness that means that the individual cannot function on their own without some form of supervision or monitoring during an acute episode of the illness or during a time of their attempts to transition from young adult into adult status. The second population we have is what are called life skill clients. These are individuals who have some experience in life but are not prepared to live totally independently. And finally, there's a group of people who do not respond to treatment earlier in their mental illness, and those individuals sometimes need lifetime or at least a significant period of time in which they're provided supervision with issues like medication, hygiene, general organization of their life. So the Mental Health Co-op provides services to all three populations. The young adult who needs treatment and who possibly through remedial services can become more independent in their functioning, who may need medication supervision, intensive counseling, development of new skills, and then the population who have some life experience but who are unable to move into independent, self-sustaining kind of life experiences. And finally, the ongoing care, or the chronic care population. The Mental Health Co-op operates in 14 living units in the near downtown area of Houston, Texas. We have houses that 2 and 3 residents live in. We have apartments in which individuals live by themselves but have ongoing staff monitoring and staff supervision. Off of our main campus of 14 buildings, we also have independent living apartments for clients who may be able to transition to living without supervision, but who may need the supportive social kind of contacts that are provided in a community such as ours. The Mental Health Co-op has a total of 80 beds at any one time divided between these three populations. We have 5 to 6 clinical full-time staff at any one time, and that will change depending upon how many people are in treatment versus how many people might be in just chronic care or ongoing care. Obviously, the treatment clients need more intensive one-on-one, individualized counseling, family counseling, and group counseling. The Mental Health Co-op is one of the agencies that provides a great deal of cognitive therapy. We're one of the centers that provide cognitive enhancement therapy in the United States. In addition, I've written a book, Defining Feelings, which is a way of looking at the emotional development and the emotional arousal of adults and helping to understand how those individuals may be impacted in their social, emotional, and sexual functioning with the onset of a mental illness. The agency provides independent living for clients who are able to reach that level of care. We provide supportive living, which means staff are available part of each day to provide direction and redirection of clients in areas of hygiene, medication compliance, and so forth. And then we provide 30 beds of supervised living, which means 24/7 there is monitoring of the individual resident's care. These residents, that is the supervised living residents, are the ones who have staff entering their apartments at all hours of the day and night, or who are provided supervised house living experiences. Our Life Skills program provides individuals more independence These individuals fix their own meals, they budget their own expenses, they do their own shopping, and they provide a different level of communal self-care than the residents in our other two programs. If you're at all interested in the services of the Mental Health Co-op, you can contact our main office at 713-524-8705, or you can email us at thementalhealthcoop.com. Thank you for your interest in our agency, and if we can provide any services, please feel free to contact us.